Hello, my name is Dr. Catherine DeUgarte, and I'm a reproductive endocrinologist and fertility doctor at Pacific Fertility Center. And this is Emma DeUgarte. She's my fertility doggie that helps a lot of my patients get pregnant and decreases stress while they're going through the infertility process. So in terms of infertility, we would like to tell you about how do you diagnose infertility and what are the steps to take in terms of becoming pregnant. Let's start with female infertility and how do you test for fertility. So in terms of women, women are born with about 1 million eggs, and by the time they're teenagers, they've lost half of their eggs. In terms of after that, each month, I call it the egg cellar. We descend into the egg cellar, we grab a bunch of eggs, and we bring them out into the living room. Each month, they're sitting in the living room, these eggs. One goes out the front door, and it ovulates. If there's no sperm to fertilize it, it dies. And a bunch of the other ones hang out in the living room for about 3 months, and then they die. So each month, this process called atresia happens in our ovaries, where a bunch of eggs die. They're always coming and going at different stages of life. And hopefully one ovulates and finds a sperm, and it becomes an embryo and lives happily ever after. However, in some women, they're born with less eggs, or they have an accelerated loss of eggs, and so they don't have as many eggs as other women their age. Conversely, some women have a lot of eggs. Some people who have polycystic ovaries have too many follicles and too many of these eggs every month. So they have more that are there, and they have a higher chance of getting something called hyperstimulation syndrome. In terms of the history, so what's important to do is when you're talking to your fertility doctor is you want to give them a history of how many medications are you taking, what allergies do you have you had any previous fertility treatments, have you had any previous fertility tests, have you had any supplements that you've been doing, are you doing acupuncture, and are you doing any things that are exposures to harmful substances such as chemicals. In terms of blood tests that we do, so when we check patients for fertility, we start by doing a blood test on the 3rd day of the period, and we check for 3 different hormones. We check for estrogen, which should be under 50, FSH level, follicle stimulating hormone, and anti-Mullerian hormone, which should be above 1. The FSH level should be under 10, the estrogen level should be under 50, and the AMH level should be above 1 for good fertility. The higher the AMH, the lower the FSH, the better. The other thing we check for is other blood tests such as thyroid, TSH level, vitamin D. I also like to check my patient's CBC, make sure they're not anemic. We also like to check for a chem and lipid panel to make sure that you don't have diabetes, hemoglobin A1C as well for diabetes testing, cholesterol to make sure you have a healthy diet. Normal weight is also important for fertility as well. So BMI, ideally under 28 is ideal for fertility. In terms of other blood tests that we check, we recommend that you check for genetic screening to make sure you're not a carrier for any mutations. And if you do have a partner, we recommend that your partner gets checked for the same mutation. In terms of other blood tests that we check for your infectious panel. We also recommend a pap smear every 3 years and a mammogram if you're over the age of 40. If you're over the age of 45, you do need to do additional testing such as cardiac testing. You need to see a high-risk doctor, and now it's also recommended that you do a colonoscopy because we want you to be a healthy mom for your kiddos. In terms of a history of birth control pills, if you're taking birth control pills continuously for many, many years, sometimes it takes a little while to get a period. It's not harmful for future fertility, but the IUD itself sometimes can cause scarring if you've had it in there and it's placed in the wrong spot, or if it's hard to remove, sometimes it can cause problems with future fertility. In terms of the male testing, we do recommend that the males check their infectious panel because when we're doing fertility testing and treatments, we require that. We also do something called a semen analysis where we check the sperm to see how many there are. Should be at least 20 million sperm per milliliters, 50% of them should be moving, and then the morphology or the shape should be at least 2% of them normal. So in terms of the other fertility causes, there could be uterine causes. So the uterus is where the baby grows. We want to look for fibroids and polyps by doing something called an HSG or fluid ultrasound to check to see if there's any problems with the uterus. If you're trying to get pregnant and it's not working for about a year, and you have to do other methods of fertility treatments, we do recommend you check an HSG, which is a hysterosalpingogram, where we check your fallopian tubes to rule out something called the hydrosalpinx to make sure your tubes are open. If your tubes are both blocked, that is an indication for in vitro fertilization. If one tube is blocked, you can still get pregnant from the other side. In terms of, I always have a conversation with my patients of how many kids they want, if they want 2 kids versus if they want 1 or 3. In terms of their age, for example, if it's a 39-year-old couple who would like 2 children, I would recommend freezing some embryos for baby number 2 and then trying to get pregnant for baby number 1, either naturally or insemination or IVF. That way, if you're waiting 2 years, by the time the next baby is coming, you at least have some embryos on ice to make sure that they're within normal limits. And then in terms of options for fertility, you can either do timed intercourse, meaning timing ovulation with intercourse, which can sometimes require ovulation kits, or we can do ultrasounds and a trigger shot to time it perfectly. You can do an intrauterine insemination, where we take some sperm and put it directly into the uterus at the time of ovulation. You can do insemination with medications, or you can do in vitro fertilization, where we remove some eggs from the ovaries at the time of ovulation. We put them together with the sperm, and then we fertilize them in vitro, and then put the best embryo back in the uterus the next month. And that's called a transfer procedure. So that's the process of fertility testing. In terms of treatments, there are several options depending on the situations. I always look at the patient's age and what their goal is. And I always recommend alternative factors such as living a healthy lifestyle, free of marijuana, free of other drugs, smoking, alcohol, decreasing stress, and increasing sleep, and doing acupuncture and supplements. And Emma, my fertility doggy, can sometimes help decrease stress when you're coming for your ultrasounds. If you're anxious, she can hold your hand and she can make the process less stressful. Thank you for your attention. If you have any other questions about infertility, please call us at Pacific Fertility Center. Either Emma or I are available to answer your questions.